Hello everyone, I am Dr. Prajwith Rai. Today we are going to discuss about the fibrinolysis. Now whenever there is a vessel injury, we saw that there will be initially vasoconstriction and there will be primary hemostatic plug. The platelets will form and plug by aggregation of the platelets, which will undergo retraction because of the actin present in it. Similarly, this platelet plug will be cemented by the fibrin clot that is formed, and once the fibrin clot is cemented, then it should not further clot the rest of the normal vessel. So there is a process of fibrinolysis. Now how does this happen? So this happens because of multiple mechanisms. The most important mechanism is the direct fibrinolysis. It is a plasmin pathway. Now what happens here is the tissue, that the endothelial cell will express something called as tissue plasminogen activator. It will release the tissue plasminogen activator, which converts the plasminogen to plasmin. Now this plasmin will break the fibrin mesh as well as fibrinogen and fibrin. It will, whenever it breaks the fibrin mesh, it will break the fibrin mesh into D-dimers. What the degradation product is called as D-dimers. Now similarly, it will break the fibrinogen and fibrin into fibrinogen degradation products or fibrin degradation products. There will be D chains, there will be Y chains, there will be E chains that will be formed here. So a plasmin pathway or a direct fibrinolysis is just a breaking of any further fibrin that is formed. So that is called as direct fibrinolysis by the plasmin, which is formed from plasminogen with the help of tissue plasminogen activator. Now, if you see the other mechanisms that are involved, the most important is the indirect fibrinolysis by protein C pathway. Now, when all the normal endothelial cells will have this molecule called as thrombomodulin. Now this thrombomodulin will bind to thrombin and it will form a complex. Now this complex will activate the protein C. Now this activated protein C will bind to protein S and calcium and it will form a complex. Now this complex will break the factor 5 and the factor 8. So this breaks the factor 5 and the factor 8. So what happens? You will not have the coagulation cascade continuing. When there is no coagulation cascade, there is no thrombin, there is no fibrinogen, there is no factor 13. So whenever there is no fibrinogen getting activated, so there is no fibrin meshwork formation. So this is the indirect pathway by the protein C pathway. Now there are some other indirect pathways such as antithrombin 3. This is the same antithrombin 3 which is potentiated when we give heparin. Now whenever we give heparin, it is not the heparin which is working, it is the antithrombin 3 that is working. Now let's see how it works. The normal endothelial surface will have this the molecule called as heparin sulfate. Now this heparin sulfate will break the antithrombin 3 and it will make it an active antithrombin 3. Now this active antithrombin 3 will go and bind to factor 2 and factor 10. It predominantly have its effect on factor 2 and factor 10, and then it has its effect on factor 9. Not only these chemicals, it has action on most of the other clotting factors. Its main effect is on factor 2 and factor 10, but it can inhibit factor 12, factor 11, 9 and 7 as well. So this is one more mechanism of indirect way of fibrinolysis, that is antithrombin 3. This is exactly how even the heparin acts, because heparin is potentiating the antithrombin 3. Now one more mechanism is tissue factor pathway inhibitor. Now as we saw that whenever there was a collagen exposed, the platelet aggregated there and the coagulation cascade was activated. Now the thrombin is produced in the coagulation cascade. When these two interact, the platelet and the thrombin, it will lead to production of tissue factor pathway inhibitor molecules by the platelets, and it can also be produced by the endothelial cells. Now this will bind to the factor 10 and it will inhibit the factor 10 and it will form a complex with factor 10 like this, and then this factor will inhibit factor 7. So it inhibited factor 10 and it inhibited factor 7. So the tissue factor pathway, the extrinsic pathway, is completely inhibited. So there is no extrinsic pathway. This is how the tissue factor pathway inhibitor works, by blocking the factor 7 and the factor 10. So these are few ways of fibrinolysis that happens in our body. Thank you. Any doubts you can share in the chat box.